We've served over 1,000 pregnant mothers and women. We've worked in hundreds of clinics and health facilities, helping them drive our idea and other ideas forward. And I think what I've also come to learn is it's not about speed. It's not about how fast you get your solution out. It's not about who raised the most money. It's about having clarity of purpose. My name is Muzalema Mwanza. I grew up in Lusaka, Zambia. I have lived here all my life. I did all my primary, tertiary education from here in Lusaka. I'm a civil engineer. I did it for 10 years in the public sector, working for various firms, and then I also did it for 5 years, running my own construction company. Encountering, something which I thought, wasn't an issue or didn't exist, and that's when I got pregnant myself. And got pregnant, and I was living at the time in a rural area in Zambia in Southern Province. And I remember being asked by the hospital to provide my own birth materials for my childbirth, being asked to bring something like a scalpel blade, delivery mat, gloves, and being shocked, first of all, that I was asked to bring these things and wondering where would I find them, right? I remember we were given a list, and there were like 7 to 8 key items we had to bring. For me, the list kind of became an obstacle. It kind of was like, okay, so this is what's stopping people from accessing equitable healthcare. What if we tear up that list, right? And replace that with something that's more affordable, more convenient, quality, easier to carry and manage. And that's how we came up with the kit. That made me, go to the Ministry of Health and find out from them to say, look, if we have these items, these kits, and we bring them into the facilities, is this something you feel you could work with? And the Ministry of Health said, yes, actually it is, And through that, we're able to work on a partnership, and we had an MOU with them. And they allowed us to have a pilot study where we were working in one of their clinics to be able to demonstrate whether this is something that will be useful to not only the medical facilities, but also the communities. Ended up having a name, and it's now our flagship product. It's called the Baby Delivery Kit. So it contains all the necessary items that a woman requires during childbirth, whether it's a home birth or a facility birth.
Kit ya Safe Motherhood Alliance imataniza because imabwela ni full package inkala na vonse vanevu mafunika. Inantandizila pamneneze na mimba ya mwana wangu wa number 3. Inantandizila maningi because sina struggling kugula. Yaneva shita Safe Motherhood Alliance ni chintu chikulu chabwino because bambiri batandizika.
Currently working with Amref Health in Zambia and also with the Africa Health Collaborative. We started working with them in 2025. I first heard of them in Nairobi, Kenya at the Afya Fest, where there was a conference and, as well as a competition in healthcare. It brought a lot of different founders and leaders from different African countries with their health innovations, and we all networked there. And working with them to be able to train community health workers in Zambia, to be able to distribute kits as well in the different communities that we work with has been transformational for us. Because what that did is it provided us this platform to be able to not only work in the communities, but also work with a partner who's already in this space, who has years of experience working with communities as well as women and children. And not only in Kenya and Zambia, but other parts of Africa. And for us, we really thrive in those kind of environments, working with those kind of partners, because what they do is they help us leverage what we're already good at. The legacy I hope my work will leave behind is, helping people realize that all it takes is to start with an idea. Like, you don't need $1 million, you don't need to come from a family that has connections. You just need the drive. And also, my advice to young entrepreneurs, young women, young men, is sit with the problem. Be close to the problem. That's the only way you come up with a solution that no one else saw. What worked for me is because I was able to see in the gaps. We've served over 1,000 pregnant mothers and women. We've worked in hundreds of clinics and health facilities, helping them drive our idea and other ideas forward. And I think what I've also come to learn is it's not about speed. It's not about how fast you get your solution out. It's not about who raised the most money. It's about having clarity of purpose. Africa needs you. Africa needs your story. Africa needs your idea, your inventions Don't let anything hold you back. Don't feel I'm not educated enough, I don't speak well enough. Speak even when your voices are shaking. Speak up to leaders. Tell them what you need in your community. And like I said, if the bridge is not ready for you, build your own bridge.